Is stem cell therapy for degenerative disc disease. 90% of people will experience back pain at some point in time. And an unfortunate few of those, about 10%, will become chronic. Now, degenerative disc disease has been shown to be the cause of 40% of chronic back pain. Most of the time when you see degenerative disc disease on an MRI, it's not symptomatic. So just because a person sees it or has it on an MRI doesn't mean he or she will be stuck with a lifetime of pain. But if they are, it really causes significant disability. Now, traditional treatment options for degenerative disc disease include physical therapy, anti-inflammatories. Now, traditional treatment options for degenerative disc disease may include physical therapy, anti-inflammatories, narcotic pain medication for short-term use, chiropractic manipulations. Various injections are available, such as intradiscal steroids, facet or medial branch blocks, possibly a radiofrequency ablation. And then surgery as a last resort, which could be either a fusion versus an artificial disc replacement. So none of these treatments actually changes the course of the problem and makes the disc regain height, regain its function. They do provide short-term relief at best, and surgery is actually kind of a roll of the dice. Regenerative medicine is here now with stem cell therapy, and the beauty of it is it's that no more Band-Aid. It actually repairs, regenerates, and can offer long-term relief, allowing patients to get back to doing what they want to do. Play with their grandkids, perform elite athletics, or just be a weekend warrior. The intervertebral disc itself has a pool of stem cells and progenitor cells. Even though it has a terrible blood supply, it does actually receive some nutrition from the end plates of the disc above and below. Now, when an exogenous stem cell is put in from an external source into the disc, it can adapt nicely to the low glucose supply, the low oxygen, and the loads that are put on it. But at least in the lab, it's shown literal tolerance to the acidity and the hypertonicity of the disc. So a lot of times those stem cells have died. Now, current research is now concentrating on the development of more biologic therapies to target the underlying degenerative disc disease to repair it or prevent degeneration. Okay, so in the past, we haven't been able to come to this point. So we've had to focus on, this artificial disc replacement or things like that. So here's a study, treatment of discogenic back pain with autologous bone marrow concentrate with a minimum 2-year follow-up. There were 26 patients who failed conservative treatment and they're kind of at the end of the road, right? And they received autologous bone marrow injection into the disc. Now, 92% of them were able to avoid surgery for a year, and 81% avoided surgery for 2 years. And durable pain relief, through the 2 years, they showed a 71% reduction in their pain scores and over 60% functional improvements at the 2-year point. So this was a dramatic outcome for a biologic procedure. Here's a study out of Europe looking at intervertebral disc repair with activated nucleus pulposus cell transplantation. So 9 patients underwent spinal fusion, and nucleus pulposus cells were cultured with autologous bone marrow. So during the fusion, they took out some nucleus pulposus cells and they cultured them with autologous bone marrow, and they injected them into the adjacent level. All right, so in this procedure, look at my, you have the fusion at the L5-S1 level, and the injection was placed into the L4-5 level. And what happens is if you have this fusion, a lot of times this disc over time will degenerate rapidly. So they did this to see would that happen or not. And what they saw is that in those 9 patients, it prevented any further disc degeneration at the adjacent level for 3 straight years. Here's a study looking at lumbar intradiscal platelet-rich plasma injections, prospective, double-blind, randomized. This study came out last year. 47 patients who had symptomatic degenerative disc disease over 6 months were followed up for 1 year with the treatment. So here's a study looking at platelet-rich plasma injections into the disc. It was prospective, double-blinded, and randomized. It was 47 patients with symptomatic degenerative disc disease who had failed over 6 months of conservative treatment. When the PRP was injected, they followed them up for 1 year. So one arm had PRP and then the other arm had contrast alone after a discogram. So what they showed was significant improvements in pain reduction, increased function, and increased satisfaction, with the results being maintained at 1 year. So effectively, what this showed is that PRP is great for disc degeneration. So what a lot of folks will do is they'll include PRP along with the stem cell therapy going into the disc. In conclusion, degenerative disc disease is usually asymptomatic, but it can lead to chronic pain and disability. And when that happens, traditional treatments and surgery have not been a great answer. Surgery is kind of a roll of the dice, and traditional treatments have kind of been like, meh for a long decades now. Biologic therapies are the best option we have moving forward, especially since these initial studies are showing exceptional results with both PRP and mesenchymal stem cells with bone marrow and also therapy.